In the midst of escalating death-related COVID-19 and catastrophic wars occurring in the Middle East, H.O.M.E continues to act as the healing hand of Christ, reaching out to tens of thousands of suffering by sharing his cure and saving love. H.O.M.E has heard the cry of the people of Lebanon after the nuclear-scale explosion in Beirut, whereby the H.O.M.E teams reached out through the mobile clinic and ambulatory medical center to thousands of Lebanese stricken by the deteriorating economic situation. Over the last few months, H.O.M.E shipped more than 100,000 masks and tons of medications and supplies to Lebanon to bind the wounds of this beloved nation. H.O.M.E has heard the cry of Iraq over the last 3 decades of civil war and the most recent surge of COVID. It reached more than ever through a mobile medical unit in Baghdad and stationary clinic that has provided health, healing, and hope to tens of thousands of beloved Iraqis. In northern Iraq particularly, after the influx of a large number of refugees to Kurdistan, H.O.M.E has established a large mobile medical unit that continues to reach to the refugees coming from that part of Iraq. In the midst of the Syrian catastrophic civil war, where more than 500,000 people have died with the escalating COVID spread among Syrian refugees, H.O.M.E continues to reach out through the Dibale Clinic in the suburb of Damascus to thousands of displaced Syrians, binding their wounds and sharing his hope and amazing grace. H.O.M.E has also reached out in Jordan through the Zarqa Mercy Clinic. Zarqa Mercy Clinic reaches out to tens of thousands of underserved Jordanians and Syrian refugees. H.O.M.E continues to support Eileen Coleman in the Anor Hospital in Mafraq with medical personnel coming from the H.O.M.E School of Medical Missions in Egypt to care for a large number of chest disease victims coming from Jordan, Iraq, Syria, and the Arabian Peninsula. In the West Bank, H.O.M.E has established a mobile ministry reaching out to the beloved Palestinian people in that part of the world that have been displaced and stricken by the high level of unemployment and poverty during the last several decades. In South Sudan, H.O.M.E has established the Good Shepherd's Clinic in Juba, and also through its mobile medical ministry that continues to reach to tens of thousands of Sudanese stricken by famine, disease, and civil war. Simultaneously, in the North African Mauritania, under the capable hands of Dr. Amanda, H.O.M.E has established one hospital and supported the work there in establishing an operating room and physical therapy unit, as well as sending physicians and nurses from Egypt to support the work. Now H.O.M.E is official in that country and is taking over under Dr. Amanda another hospital in northern Mauritania. In Egypt, H.O.M.E has found itself among many Christ-centered physicians and nurses and was able to establish a clinic in Nasser City as well as an Autism Center. In 2020, H.O.M.E has acquired a large new mobile clinic with teams that are already reaching to thousands of underserved people in Cairo and Upper Egypt. Also in Egypt, H.O.M.E has established the Eileen Coleman Nursing Training Program, which has trained more than 140 nurse assistants and now supports nurses going to school to be registered nurses with a mission that would reach out to various parts of Egypt and the Arab world. Jointly with Doctors with a Mission that has been established through the School of Medical Missions, a large number of healthcare workers continue to serve as medical ambassadors to Egypt and the rest of the world. Also in Egypt, H.O.M.E continues its medical media ministry, which airs on satellite TV and has established more than 150 TV episodes and programs. This ministry provides medical education and also the message of the good news to at least 10 million people on a weekly basis. Our dream has now become a reality with the acquisition of the 5-story H.O.M.E hospital in New Cairo, Egypt. This medical center will be the hub for our School of Medical Missions that would provide high-quality care associated with a training program for young physicians and nurses who would be trained not only medically but also spiritually to become medical ambassadors and missionaries to various parts of the Arab world. In Yemen, H.O.M.E has also heard the cry of the Yemeni people in the midst of a devastating civil war with more than 50% of the 30 million population threatened by cholera and famine. There also H.O.M.E is providing health, healing, and hope. In the United Arab Emirates, the 200-bed Kanad Oasis Hospital that cares for more than 180,000 patients every year has joined the H.O.M.E network and its mission in reaching out to beloved Arabs with healing and grace. Every year, the H.O.M.E network reaches out to more than 200,000 suffering people in the Middle East, and each one of them is calling on us and you. Come and help us. Come and help us. Come and help us. Could you join us and be part of the healing hand of Christ as we heed his voice saying, "Whatever you do for one of the least of my brothers and sisters of mine, you did for me."